Dr.
Hello.
TuHuynh, go ahead. Your
Hi,
10
thank
minutes
you.
starts now.
Thank you for the opportunity. And my name is Dr. Tran TuHuynh. I'm going to share the screen, but as I'm doing that, just tell you a little bit about myself. I am still a practicing surgeon, as I'm sure many of you guys here are, as practicing physicians. I work in breast cancer surgery and women's health, but before that, I work in general surgery. And then before that, I worked in biomedical engineering. I worked on nanotechnology, medical device, tissue engineering, and DNA technology. And in that journey, saw that there were so many different things that we can make an impact on in healthcare. Are you guys able to see my screen?
Yes.
Great, thank you. So 4 years ago, our team came together from various expertise as clinicians, as engineers, as people who've worked in med tech, people who've worked in deep tech, and people who've worked in regulatory, with a shared mission of understanding that in order to improve patient care delivery, we have to improve the workflow optimization for the people who care for patients, essentially, and the ability to expand care capacity and extend providers' reach. And from our various expertise, a few things that we understood is that there's universal healthcare problems stemming from suboptimal workflow. I think you guys know a lot about this already, and a lot of great presentations have addressed these aspects relating to medical errors, burns out and shortages, and waste in healthcare expenditures. In addition to that, there's also a looming shortage of healthcare professional, and they're projecting a 23,000 surgeon shortage in 2030 to a 140,000 physician shortage in 2033 and 175,000 nursing shortage every year. And so what we have come to understand that the weaknesses in the care continuum is that certain current solutions hinder patient care delivery and workflow, and really hinders the ability to access meaningful support while caring for patients. And of course, increased specialty demand and lacking expert resources, along with remote care disparity, is a huge problem that can cause a lot of complications and inefficiency in care, and along with other aspects. And we won't overburden that, but I think we all know what that is. So who suffer from all of these is, of course, the patients themselves and healthcare providers, frontline workers, along with the healthcare systems that's been very strained. Current telehealth platforms are really not optimized for frontline providers' collaboration and workflow. They're really great for consumer to provider, but you can imagine how holding up a phone with one hand while you're trying to examine and talk to your colleague or someone remotely, or trying to adjust a tablet on a rolling stand could be cumbersome and obstructive and impede workflow. In addition to that, current solutions lack telecollaboration capability to connect multiple, in various fashion lack ability to connect multiple participants and or interact in a meaningful way or draw, annotate, and such. Now, a clinical example is that you can have 1,000 ventilators, but if you only have 10 people who know how to use them, and those 10 people cannot be in 1,000 places at once, how do you allow them to meaningfully collaborate with someone already at bedside, to expand care capacity and to extend the reach of the remote person? And so an ability to collaborate in meaningful fashion remotely. So the best way to really highlight this concept and what we're doing in terms of using augmented reality and our proprietary software platform embedded on smart glasses, augmented glasses, and allowing people to collaborate is a short video. And this is actually being recorded from the headset itself. What you can see here is using voice and gesture. I can call out to someone remotely, and the remote person, all they need is a phone, a computer, or a tablet and Wi-Fi. You can see that they can see what I'm seeing.
I'm doing some surgeries on fruits, and
from a first-person view, a direct first-person view.
Can you see what I see?
Yeah, you got a banana, a lemon, an orange, and an apple.
And it's essentially that replication of point of view vantage, and along with communicating in terms of providing guidance and real time of what's happening. And so you could imagine how meaningful this could be.
Well, which one is the lemon?
being able to talk about apples to
Understood.
apples or apples to oranges. So what this, our solution is a proprietary software platform that is hardware flexible, that could be on any off-the-shelf hardware that we have vetted and QA'd. It's a patent pending HIPAA compliant platform that connects multiple participants, that is shared visual content that allow for meaningful interaction and also annotation. And the reason this is so exciting and important is that we have seen that the pandemic has exposed the hidden weaknesses of the current system that concentrates so heavily on hospital care. And the paradigm is shifting to where we need to deliver care outside of the hospital, but still maintain the skills and also the standard of care. And the meaningful way to do that is looking at the history of technology from where we used to have these telegraph and then telephone and then smartphones, but now we actually have mixed reality enabled smart glasses to help us get there. And so that we can do things and collaborate in a hands-free fashion. And the opportunities is huge. Right now, we have about 6,000 hospitals in the emergency room in the US, but we have actually approximately 12,000 plus ambulatory surgery centers, 12,000 plus nursing homes and assisted living and elder care, countless number of physicians, offices and specialties, and of course, more than 7,000 urgent care and dialysis centers and such. And so all of that to say, we already have the brick and mortar infrastructure that have people and skilled expertise. Now we have the ability to expand what we can do and the care that we can give and collaborate in a meaningful fashion. So the return of investments for the end users is in many folds. It's really about enhancing patient care delivery and efficiency and collaboration. Instead of needing someone to physically be there, the remote person can meaningfully collaborate with someone already at bedside. And you can imagine the cost saving potentials and minimizing systemic waste. And of course, with telehealth and such, the ability for reimbursement and making up the economics of that. Based on what we've learned so far, the clinical aspects has been really impactful and popular, but there's also other aspects of collaboration that has also been important, that is education and training, along with device supports and surgery and such. This is our clinical team. And essentially, the goal is to collaborate in a meaningful fashion next to teletransportation, allowing someone to be virtually where they need to be. Thank you.
Thanks, Dr. Tran. It's time for judges to ask questions.
Thank you for your presentation. I'm curious if you could please comment on your team. I know you have a slide, but we flew through it too quickly. And also if you could comment on the timeline of what was done and what are your next implementation steps.
Yep. So our team is so we have people who've actually worked in the deep tech with mixed reality and artificial intelligence and such. And then we also have people who've worked in medical device for various fashion who has helped build and commercialize products for Philips, GE, Healthineers. We've also had people who worked in regulatory, people who've also worked at the FDA previously, and of course, other clinicians and engineers as well. And so it's a team that is very diverse with deep expertise coming together for a shared mission. And so we have done proof of concept, cadaver testing, and then have actually also done paid pilots. And we're actually commercializing our product this month.
Do you have any users right now? Where are you in terms of finding clients? And
Yep. Yeah. So we actually have users and we're in paid pilots with them. We fortunately, we actually have a wait list. We have more interest in our bandwidth. As you can see, the utilization potential is so wide. and it could be utilized from various fashion, from remote care to elder care to the ER to the ICU to the hospital to surgery, and of course education and training and such. And so we've really been working diligently to externally validate and improve, and working with the people in the trenches, the end users, to improve this product. And now we're actually ready to commercialize. And so there'll be exciting news coming up.
Could you please comment more on?
I'm sorry, I missed the questions.
You can go ahead, Ferdinand.
I was simply going to ask, since you said that you have, do you mean you have revenues, or are you currently pre-revenue? Sorry, you may not have heard me.
Yep, yeah, we're currently, we consider ourselves pre-revenue, but have been in paid pilots.
My question was also about the funding. Can you elaborate on what is your funding and revenue stream?
Yep. So right now we've been mostly angels funded and self-funded, but we also have had diversity and VCs who have funded. More than 50% of our investors are physicians and surgeons, people who want to see and use this tool, and also the end user. And we're thinking about just doing a price round in the near future.
So once this device is implemented, who will be paying for it? How much? Can you comment along these lines?
Yeah, so based on what we've learned is that the payments can vary. It depends, because our customers base is so wide with so much potential at this time. So we have elder care, assisted care facilities that are interested in this, and so that's their own payment system. And then there's also the hospitals and private practices and health systems. For us, it's a SaaS model. It's a subscription model based on the number of total solutions that we sell. Each total solution includes hardware that we've already vetted, along with our proprietary software embedded, along with education and training for utilization and support. It can be done as a yearly basis or monthly subscription.
Okay, thank you very much, judges. It's time to score.